procedure, I'm going to demonstrate sterile catheterization on a male and a female. I am going to wash my hands, I'm going to provide privacy, I'm going to identify the patient using two identifiers, I'm going to make sure to follow all standard precautions and then document at the end. So here is a female. I am standing on her left side because I am left-handed. I have covered her to provide privacy and only exposing the part that I'm working with. I'm going to begin by cleaning it first before starting sterile catheterization. So I am going to clean the perineum area starting from front to back. So you wipe from front to back. Using a new wipe, you go from front to back. You dispose using a new wipe, front to back, and then again front to back and dispose. So I would dispose, and then also I would now remove my gloves. And I would perform hand hygiene. After the patient has been cleaned, I'm going to apply a sterile pad under her, only touching the corners and being careful to not touch the inside, and the shiny part is down. In this case, my area is not big enough, so we're going to fold it halfway. There's that. And then I would open my sterile package, beginning by only touching the corners and organizing my work area. And then I would begin by applying my sterile gloves. Nope, this is not working out as well. Okay. So it's not on right, but we can fix it in a second. I will grab the other one, step back. That one went on good. So now we can touch this one and we can fix it. Being careful to not touch the sterile part of the glove. And you would do it by pulling down on your palm. There we go. So now that I have sterile gloves on, I can now touch what's inside here. So I would begin by placing this on the perineum area. So there's that. And I would organize my supplies. So I have all my supplies out, and I'm going to squeeze some lubricant on the tray. Okay. And I'm going to go ahead and put this tip here, and I'm going to roll it in the lubricant and let it sit there. And I have my alcohol open and ready to go. So now I'm going to place my non-dominant hand on top of the perineum. I'm going to use my thumb and my forefinger to separate the labia and expose the urinary meatus. I'm going to clean from inside far labium, inside near labium, and then down the urinary meatus. So inside far, inside near, it's the other side. And then down the middle and discard. And also make sure that you do not let go, or you will have to start over because it will become contaminated. So I'm going to coil the catheter, and then I'm going to tell the patient to bear down as if she's trying to void. And I'm going to insert about 5 to 7.5 centimeters. I'm using my dominant hand to insert it. And I'm going to tell the patient to take slow, deep breaths until the initial discomfort has passed. So we're going to begin. And then if you feel resistant, you would turn it and apply gentle pressure, but do not force the catheter. So it's going in, and then you would keep going until you see urine come out, urine flow out, and then once urine flows out, you go in about 2.5 to 5 more centimeters. So once all the urine has drained and the bladder is now empty, you can pinch the catheter and you can slowly withdraw it out, and then you're going to dispose of it in a receptacle. So after we have removed the catheter, now we can remove this and put it in a receptacle. And now I'm going to take my gloves off, and I'm going to perform hand hygiene. And I'm now going to clean the patient again. So now that I have done on my gloves, I am now going to wash the patient. So again, like in the beginning, you go from front to back. So you spread the labia, you go front to back, dispose, get a new wipe, the other side front to back, dispose, then the middle front to back, and then the other side front to back, dispose. And then I would remove my gloves after I have washed her, and then I would perform hand hygiene. And so after I have cleaned the patient's perineal area, I have disposed of my gloves and I have performed hand hygiene. I'm now going to don on new gloves. I'm going to cover the patient. I'm going to ask her if she's comfortable. I'm going to give her her call light. And then I'm going to, with my gloves on, I'm going to dispose of my supplies. And then I can go and wash my hands, remove my gloves, and then I would go document. So now I'm going to demonstrate sterile catheterization on a male, and I'm standing on his left side because I am left-handed. I introduce myself, I identify the patient, I provide privacy, and I will document at the end. So I'm performing hand hygiene. I'm going to don on gloves, and the first thing we are going to do is we're going to make sure he's in a supine position, and I'm going to only expose the area that I'm working with. So his legs are covered, and we are going to use wipes. And then again, you use one wipe for each area. So you would go down, dispose, down, dispose, dispose, dispose. So after I have cleaned him, I am going to remove my gloves, perform hand hygiene, and here is my sterile kit. And I'm going to begin by opening it up, only touching the corners so I don't contaminate anything. And then my fenestrated, can't remember what it's called, but the shiny part will go down, and since my area is too small, I'm going to fold it. So now I want to don on gloves, the sterile gloves that are given here. So now that I have my sterile gloves on, I can now touch stuff in the kit. So the fenestrated drape is going to go, the center is going to go right on the penis, right here, making sure not to contaminate anything else. And now I can organize my work area. And we are going to lubricate the tip of the catheter. We're going to make sure my supplies are open and ready to go. So here are my alcohol swab sticks, that's open. So I'm going to scoot my supplies closer. I'm going to use my non-dominant hand. I'm going to hold the penis 90 degrees supine to the body. This hand is now contaminated. So you hold the penis gently but firmly. If he is uncircumcised, you're going to retract the foreskin and expose it meatus If the skin comes back up, it is now contaminated and you have to start over. So we're going to begin by cleaning the meatus, and you want to start at the meatus and work your way down the shaft of the penis. So, and then you discard. Again, start at the meatus, go in circular motions down. Okay, so now I'm going to start by inserting the catheter. I'm going to ask the patient to bear down as if he's trying to void, and if there is resistance, I will withdraw the catheter. So I'm now going to begin. Okay, and then once I see urine, I will go down. I would insert it 1 to 2 more inches. So after urine has flown and the urinary bladder has been emptied, we can now withdraw slowly. Part of this in the receptacle. It's been stuck. Okay, so I'm going to now get rid of this, and I'm going to discard of this also. I'm going to tell the patient he can pull his gown down now. I'm going to dispose of my gloves as well. I'm going to perform hand hygiene. I'm going to don on new gloves. And I'm going to cover the patient up, and then I'm going to put him in a comfortable position. I'm going to give him his call light, have that in reach. I'm going to get rid of my supplies, and then I will document.